Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, November 2nd. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and General Manager, Chief Pegg. Go ahead, Mayor Tory.
Well, Evan, thank you and good afternoon. May I begin by saying thank you to parents and kids for the cooperation we saw on Halloween, on doing Halloween differently. I suspect there are a few parents out there who actually were relieved at how doing Halloween differently manifested itself. And with kids being kids, my guess is that most kids won't even remember that Halloween was done differently in 2020. And that will include missed opportunities to spread the virus, the COVID-19 virus, by doing it the normal way. And so I appreciate, as mayor, the cooperation and the imagination and the patience that was shown by parents and by kids in doing Halloween differently. And I hope that we can do it bigger and better than ever next year at this time. Throughout the pandemic, the city has been working to provide spaces and facilities to support the efforts to fight COVID-19. At the heart of many of our neighborhoods, as you know, are libraries and community centers, recreation centers, parks, and other city hubs. These important places have been on the front line of supporting Torontonians, ensuring access to information, providing for food security, and facilitating access to health care. Schools across Toronto are now using more than 220 city parks for outdoor learning as part of our commitment to supporting the back-to-school and reopening of the school effort. Teachers and students are using these spaces for physical education, lessons that would traditionally be in class, and for socially distanced recess. And all of this is happening while the parks remain open to the public during school hours and available for permitted and program uses at night and on weekends. Other parks and recreation sites have also been used for food bank distribution, flu shot clinics, and COVID-19 testing. In total, 13 pop-up testing locations have been established in parks and recreation facilities, with more coming soon in some of our more vulnerable neighborhoods. These clinics are a collaboration with provincial colleagues at Ontario Health and with community health organizations. They're open to walk-ins and offer low-barrier testing for residents, including individuals experiencing homelessness. I visited the Elm Bank Community Centre yesterday with Premier Ford, Councillor Ford, and Councillor Cressy. I want to thank the Rexdale Community Health Centre, who is hosting this pop-up site and who have done so for a few weeks now. They know the area residents. They are aware of some of the anxieties about COVID-19 and even about testing that are experienced by some of those residents, and as a result, people from the Rexdale organization are ideal to host and operate these accessible testing sites. That will also be true in the east end of the City of Toronto, where some new sites will be announced today. They've been announced, in fact, 7 pop-up sites in the east end of the city that will be operated by familiar health organizations in conjunction with the province and with the city. So it's a partnership of those different organizations. I want to encourage people to get tested if they're experiencing COVID symptoms. I know that there are some residents who have concerns about getting tested. They worry it could cost them their job or lead to other complications in their lives. Getting tested is the best way to protect yourself and your family. You will be tested in these community settings, in these pop-up clinics. You'll be tested by people you can trust. You'll probably see people there that you know, because they're people you're used to dealing with at these different community health organizations. For example, at Falstaff, the people from the Black Creek Community Health Centre were there, and they know the residents, and the residents know them. And this is a very important element of why they are such essential partners to these pop-up testing centres. Getting tested is the best way to protect yourself and to protect your family, and it will help us to stop the spread of the virus. I will also be working with these community health centres to reach out to residents through robocalls, for example, in order to have people understanding that the testing is available and that it will help and that it will be conducted by people who can be trusted by the residents. This is something that Councillor Ford, Premier Ford, and I all agreed to do, to record these phone calls to encourage people to come out and have this testing. We were told at Elm Bank and at Falstaff, which I visited with Councillors Cressy and Nunziata, that these visits and the automated calls from public figures, such as Premier Ford and myself, will help diminish the anxieties and promote these sites, which I'm quite prepared to spend as much time doing as will be helpful. Regular access to reliable information is another crucial aspect to stopping the spread of COVID-19. People need to know about how to protect themselves and loved ones and where to find support. Free Wi-Fi access continues to be available inside and outside of all Toronto Library locations 24/7, even when the libraries themselves are closed. The 82 operating branches have also provided for computer access, which was prioritized upon reopening for students, for job seekers, and anyone looking to access the internet. At their peak mobilization, 12 Toronto Public Library branches were also used to feed their neighbours, while community agencies put pandemic processes in place and resumed their operations. By the end of September, Toronto Public Library branches had provided for almost 14,000 hampers, and branches have now served more than 16,000 households, representing more than 46,000 people with food security issues. The Albion and Jane Shepherd Toronto Public Library branches continue to host North York Harvest food banks. The Albion branch is in Etobicoke North, and Jane Shepherd is in Humber River Black Creek, two neighbourhoods in northwest Toronto that have been particularly hard hit by COVID-19 and where food security remains a priority. These are just some of our efforts to support the ongoing fight against COVID-19. It is important work, and it will help us to ensure that we get the virus under control and provide supports for the people that are affected by the pandemic. I've also been working closely with Dr. Davila and with the province, including the Premier, to assist in the new development of a framework which can take us forward and find ways to open doors safely. We're learning every day, and we're trying our best to make the best overall decisions for the city as a whole, which is what we must do. These are difficult, complex decisions, still with many unknowns, but I remain convinced that together, in a spirit of collaboration and, yes, compliance by all of us, individual compliance as well as institutional compliance, that we can all continue to move forward together. And on that note, I would ask Dr. Davila to offer her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Today, I am reporting 330 new COVID-19 cases. 149 people in Toronto are hospitalized as a result of COVID-19, and 34 people are currently in intensive care units. The reported case rate seems to have plateaued at just above 300 new cases per day, which is further supported by the reproductive number, which is at 1. While this is not where I would like our numbers to be, the situation is not escalating. However, it was a difficult weekend in far too many places elsewhere in the world, as COVID-19's resurgence takes a renewed toll. The United Kingdom is just about to go into a 4-week national lockdown again in response to the escalating cases of COVID-19 there. On Saturday, the United Kingdom was just shy of 22,000 confirmed new cases. Our comparative good fortune in this country and in Toronto is something we should try our very best to protect. So I'm glad to share with you my understanding that overall, our city largely adapted successfully to Halloween this year. Anecdotally, I've heard that while there was significantly less door-to-door trick-or-treating, many families showed their creativity and their ingenuity in celebrating Halloween without door-to-door trick-or-treating this year. I've consistently heard about safely distanced costume parades outdoors, and I just want to extend my thanks to these people. In addition to making choices consistent with the reality of the world we're living in right now, you set a great example for your kids and for all of us. We're going to need resilience and imagination and adaptability to get through the winter and to the days ahead when we're getting vaccinations and putting COVID-19 behind us. You were a great example this weekend, and I'm glad you're out there. So thank you once again. The next big celebration that bears thinking about in the context of COVID-19 is Diwali, the Festival of Light, celebrated in the coming weeks by the Hindu community. It is traditionally a time of significant gathering by family and friends. And for the benefit of everyone in Toronto, I urge all of you celebrating Diwali this year to set another example for all of us by adapting your celebrations such that you, your family, and your friends come through Diwali in good health. The Indo-Canada Arts Council describes Diwali as the spiritual victory of light over darkness, good over evil, and knowledge over ignorance. As we try to celebrate with COVID-19 as an inevitable but unwanted guest, two words from that description seem to me particularly resonant: victory and knowledge. In 2020, victory over COVID-19 comes from knowledge. Whatever we may celebrate, we have reached a point in the year where we must think about how fundamentally difficult it is to accept there is risk, even danger, in events where we come together for the pleasure of each other's company. The idea defies what we take for granted, that celebration is the time when we put aside the worries of everyday life to take a little time just to relax and enjoy. I want to share a couple of examples of celebrations from around the province earlier this fall that went wrong because of COVID-19, because they illustrate what can happen if we don't adapt and persist in coming together as if nothing has changed. I've read a report about a bachelor party where a party of 13 men were at 2 different bars. One of them had a mild headache and a runny nose. He thought he was having seasonal allergies. It turned out to be COVID-19. As a result of this evening, 3 people tested positive for the virus, but the event generated 16 high-risk contacts and more than 120 lower-risk contacts. The high-risk contacts were all advised to self-isolate for 14 days. That's not to say anything about the stress for all of them, waiting and wondering if they were infected with COVID-19 while they counted the days until they were in the clear. 2 other examples could have happened to anyone and show just how quickly the virus can spread. In the first, 10 friends gathered at a cottage. One person developed symptoms of what seemed like a cold, but tested positive for COVID-19 after returning home. In the end, one person with symptoms led to 40 confirmed cases in 9 days. In late September, 40 people attended a barbecue in a park. That gathering, outdoors, led to 27 confirmed cases of COVID-19, and in this instance, because children were involved, 105 high-risk contacts through school, all of whom had to self-isolate for 14 days. As I've said before, you don't get COVID-19 from a place. You get COVID-19 from another person. Where you are can play a part, whether indoors and outdoors. The risk is real and ever-present if you're not taking steps to protect yourself. Spending as little time as possible with people you don't live with. Keeping a distance of at least 6 feet from people you don't live with when you do spend time together. Wearing a mask as much as possible, washing your hands frequently, and staying apart from others at any sign of illness. So as we move into the colder months, spending more time indoors, and when we gather together even more than usual, I'm asking you to think about what you can do to stay safer and what changes you're willing to make to do it, because the risks are real and the choice is ours. As your medical officer of health, I would love to see COVID-19 eliminated in our city. Practically speaking, at this point, I think the best we can do is drive the infection rates down. Optimistically, I believe we can do this, but it will take all of us working together towards that common goal. We are capable of having the upper hand against COVID-19, but only if we're constantly thinking about how to do this. I know we've got it in us. We saw it over the weekend when parents and kids decided they could celebrate Halloween by adapting. I hope adapting is something we will all try to do, not just for the holidays, but every day. It will probably feel like a long winter, but with every passing day, we're one day closer to vaccinations and life more like we knew it before COVID-19. I'd like to see the absolute maximum number of us get there in good health. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila. Good afternoon. Halloween is always a busy and often demanding night for our emergency services and healthcare professionals. And while emergency response call volumes are always higher than normal on Halloween night, I'm very pleased to report that we did not experience abnormal increases over the course of Halloween 2020. In response to COVID-19, each of us were asked to adjust our normal plans as we continue to work together to stop the spread of the virus in our city. And I'm both thankful and appreciative of the fact that the vast majority of us did just that. Over the course of the weekend, our enforcement teams responded to 33 complaints relating to private gatherings. Following response and investigation by our municipal law enforcement officers and Toronto police officers, only 2 of these complaints resulted in enforcement action being required, resulting in 2 tickets being issued. The remaining 31 complaints did not require further enforcement action. Thank you, Toronto, for being so considerate and so diligent. I'm pleased to report that our officers only had to respond to and deal with 1 large Halloween gathering, which involved approximately 60 to 70 people. This event was responded to and dealt with quickly. It is my understanding that charges were laid against one of the organizers of this event and that this matter remains under investigation. I want to both acknowledge and thank everyone in Toronto for their consideration this weekend and for continuing to follow the public health measures as we work together to stop the spread of COVID-19. In closing, I again want to acknowledge and thank every resident, every business owner, and everyone in our city who is being impacted as we do our very best to stop COVID-19. As always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Mayor Tory, Dr. Davila, and Chief Pegg. We will now open the floor to questions. As a reminder, it's 1 question, 1 follow-up. We are also having a little bit of technical difficulties, so we are asking the media to unmute and mute yourself when you are up. We also have staff on the line who can answer your questions if you need an answer from them. First up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, good afternoon. Mayor Tory, I'm just wondering, I know we don't have the details on what the Doors Open Safe plan will actually be, but when do you plan on actually unveiling that so that businesses affected won't have to respond to it last minute?
Well, I expect it's not actually going to work that way for how this will unfold, Matt. Thank you for the question. What I think is going to happen is we've been in basically continuous discussion with the province, because let's remember it is their order that is in place today affecting a number of different businesses, restaurants, bars, gyms, and so on. And I expect it is likely that their order or an order from them would be in place after the 28-day period at some point, a different order. So we've been working very closely with our own Toronto Health people, and they in turn have been working, as we have at the political level, they've been working with their counterparts in Ontario Public Health. And I think the objective is to come out with a framework, which I suspect you'll hear announced from them as opposed to from us, that would apply everywhere. It may apply at different times and in different ways everywhere, but I think it'll be a common framework, because I think that's what everybody wanted to try to achieve, to avoid confusion and have clarity, depending obviously on the circumstances that are outstanding at any given place at any given time, including the City of Toronto.
Okay, thank you. And Dr. Davila, I'm just wondering, I thought of this as I was putting on my gloves this morning. Do you have any changes in public health directives when it comes to what people should be doing in cold weather? Like when I'm around, touching stuff with mittens or something like that, should you be thinking about changing them more often or washing them more often like you would with a mask?
So Matt, that's a great question. And I think that when it comes to what we understand more and more about with COVID-19, it's that the pickup of COVID-19 from surfaces is less of a factor than COVID-19 transmission that actually comes from close contact with other people, particularly when you're in crowds, in close contact, and in closed type settings. So I think that what applies here is just good, solid hygiene. Wash your hands, and I would wash your gloves when they're dirty, and certainly not try to touch your face if they've been out and about touching different surfaces. But I don't think there's anything particularly special that needs to be done to your gloves. I do think that the general COVID-19 advice that we've been providing, the good steps for self-protection, watching your distance, wearing your mask, washing your hands, staying home when you're sick, those, of course, continue to be the most important things that each of us can do to prevent the spread of COVID-19.
Thanks, Matt. Next up, we have Lucas from News Talk 1010. Go ahead, Lucas.
Thanks, Lavin. Chief Pegg, can you elaborate a little bit more on that large event that you were talking about? And it's your understanding that an organizer was charged. And specifically, I mean, looking at the recent numbers that came from the province, the 14% from the restaurants and bars, and what Dr. Davila was just talking about with the bachelor party, et cetera. Why didn't we have a ton of tickets issued at an event like this? Why just the one charge against the organizer? Why not kind of crack down a little bit more on all these people that were apparently there? So could you elaborate on this?
Sure, Lucas. Let me start. I know we have colleagues from Toronto Police on the line as well. So as we've talked about in the past, and I think we can all appreciate that each and every one of these circumstances is unique and requires that our not only municipal law enforcement professionals but our Toronto police officers respond. They evaluate the situation at hand, and then, based on their own independence of authority, make a determination as to what type of enforcement action is warranted and required in the circumstances. With respect to your questions relating to the particular incident this weekend, Lavin, I'll pass off to the police colleagues on the line, if that's okay.
I think we have the superintendent on the line. Go ahead.
Yeah, just exactly what Chief Pegg said. The organizer was identified and he was charged only. We do have to, based on the situation, there was about 60 to 70 individuals that were there. Halloween party hosted by anti-maskers. So it's just based on the investigation at hand, and the investigation led us to charge only the operator of this party, the organizer.
Okay, go ahead,
Right,
Mayor. Lucas, the mayor just wants to add a comment.
I just want to make a comment.
Sorry, go ahead, Mayor. Yeah.
I just believe if we're going to move to some kind of a doors open safely regime, which I dearly hope that we will, and that everybody will reach an agreement on how that can be done safely, that part of that is going to have to be that, and I've said this before, but I'm hoping the day will come, because I don't control law enforcement, that the days of warnings are over. And that people are going to be, if they're found in these places when they shouldn't be, or in circumstances where they shouldn't be, or operating in a way that is contrary to these orders that are meant to allow doors to be open safely, then there's going to be a price to be paid for that. And I don't control that, but I certainly want to make my opinion known, because I think it's going to be a very important element of being able to go forward safely and make sure people understand that the rules are for real.
Right. Well, I totally understand that, Mayor. But right now there hasn't been that type of penalty. If there's just one charge and not other people are being ticketed. I mean, for example, in Manitoba, Premier Palliser just said that he's asking people reduce their contacts by 75% over the month of November. So I'm just trying to get an understanding of what is the city doing to really address, gatherings, whether they're anti-maskers or not, but, large gatherings where those public health rules are not being followed. I'm wondering what the strategy is for dealing with that if we continue to see these types of events where they lead to dozens and dozens of confirmed cases.
That's probably.
And that could be for anyone.
Sure, I'll respond, Lucas, to Chief Pegg. The strategy, Lucas, is I would say consistent with where we have been from the start. I can tell you that, as you just heard from Mayor Tory, the issue of enforcement, the issue of doing all that we can do to make sure that we are playing our part and that we are taking as I would say affirmative action as we can take with respect to ensuring compliance with the public health orders and regulations is a top priority for our strategic command team and a top priority for the city. That being said, there always has been and there will always be that all-important independence of investigative and enforcement authority on the part of the responding officers. So the strategy is to do all that we can do. We've focused for many, many months, as you know, on making education our first go-to, if you will. We spent much of the summer working very, very diligently to make sure that people understand enforcement action does happen when complaints are received through 311. They are triaged and prioritized for our responding officers. They do respond, and as we just heard Superintendent from Toronto Police indicate, where there is enforcement action warranted, that enforcement action is taken. That is a priority for us. It will continue to be a priority for us and will continue to be a priority for the City Strategic Command Team as we move forward.
Thanks, Lucas. Next up, we have Nick from the CBC. Go ahead, Nick.
Hi, everyone. Question for Mayor Tory and Dr. Davila about active TO. The program seems to be essentially over now with the road closures and quiet streets ended after this past weekend. So I'm just wondering, do you feel like the city's missing an opportunity maybe now to create opportunities to promote outdoor distanced activity? And do you have any concerns that without some of those opportunities, that could be bad for the city's efforts to fight the pandemic here?
Well, first of all, I will say that because of the impending really good weather, unusually good weather for this weekend, I've asked the city staff to take a look at what they think will be the likely crowding levels on the bike paths, because you'll recall the instigation of the active TO was in part because we expected large numbers of people would be trying to get some outside activity, as we were encouraging them to do, and that some of the bike paths in the area of the waterfront in particular would be overcrowded. And so I've asked them to take a look at whether we could squeeze one more weekend out of the program, recognizing that a lot of the people who have to prepare for winter and so on are the same people who set up active TO. So stay tuned on that. I will just say as well, though, that I've also asked, I think as you know, I've asked the staff to come forward, which I expect they will in the very near future, with a series of additional winter-related activities that probably wouldn't consist of having roads closed on the weekend, given what people might or might not want to do on a winter weekend, but might consist of different kinds of activities we could have in the parks, different kinds of things we could, plow or keep open that may not normally get plowed, that sort of thing. And so they're busily at work on that, I know, and as soon as their results of their work are in my hands, we will let you know.
So perhaps if I can just add a little bit to that, I think what you've heard the mayor just comment on is a reflection of adapting to life with COVID-19. And you heard in my remarks, I've asked people to think about how we can responsibly and successfully adapt to life with COVID-19 at an individual level. Certainly that can happen at a city level as well. And I think you're hearing some very good examples of exactly that.
Follow-up, Nick?
Yeah, this is just a question on behalf of my colleague, Ali Chiasson. It's about, we saw the entire teaching staff today at Glamorgan Public School in Scarborough. They refused to work because they said the school is unsafe. There's been an outbreak there, 9 staff, 2 students, but the school is still open. So to Dr. Davila, can you explain to us why the school hasn't been closed in this case? And can you tell us what the safe threshold is for cases at one school, say, before it would be shut down?
So at this point, I don't have the specific details of the investigation. I've certainly heard of the challenges that are being experienced there. If there is a question of safety around supervision and adequacy of staff in terms of the numbers of teachers that are available to supervise the students, that's not so much a public health issue as it is more of a school administrative issue. And I would leave that in the very capable hands of our colleagues there within the school and at the school board as well. But it's my understanding that we are working in partnership with the school board and the school to make sure that we are managing that which is happening in the school from a public health perspective. And I do think it's really important to note that, our teams have been working really well collaboratively with each other, school board, Toronto Public Health, and the individual schools. We have roughly about 1,200 schools in the city of Toronto, and we have had, thankfully, so far, very little by way of outbreak situations within our schools, and I think this is due in large part to that very collaborative relationship and the best foot forward that has been put forth by all the different partners in terms of infection prevention and control and all the COVID-19 adaptations and adjustments that have been made.
Okay, thanks, Nick. Next up, we have Shalima from Global. Go ahead.
Hi there. This question is for Dr. Davila, and it's actually quite similar to the last one with respect to the school in Scarborough. What I did want to ask specifically is, given that there are 11 confirmed cases of COVID-19 at this school, and still it's been given the green light to reopen, what type of criteria is actually taken into consideration when closing down a school?
So there are a number of different circumstances that need to be considered, and really what you're looking for is, is there evidence of transmission per se within the context of the school? So there is COVID-19 circulating in our community. And for many students in our schools, for many young people in our community, the exposure actually has nothing to do with school, but in fact has to do with what is happening out in their community and people they might be exposed to in their own personal lives. I think the other thing that's important to consider is, what measures have been taken and whether in fact the students have been at school during that point in time in their infection where they may have been infectious. And in many cases, I can't speak specifically to all the cases at this particular school, but certainly over the course of the fall, we have heard of a number of students who've been diagnosed with COVID-19 infections, but in fact have not posed a risk within schools because they haven't been at school during their period of communicability. So there are many different considerations and many different factors that go into the investigation. All of those factors and considerations are taken, are carefully looked at, because our concern from the public health perspective is ensuring that we're working with our school partners and with our school communities to create as safe an environment as is possible.
Follow-up, Shalima?
I did want to also kind of delve into the fact that, there may be some parents who are wondering this as well. When we looked at Mason Road, there were about 4 cases, and that school was closed down for proper cleaning after investigation. So what would really separate that scenario where we have a school with 4 cases to a school with 11 cases and it's not being shut down? What separates the two?
Well, again, I can't speak to the specific circumstances between these two and the differences between these two schools, but suffice it to say that there is an investigation that happens, and it's a question of whether there is a risk of transmission or, risks that need to be accounted for within the school setting. Each investigation is going to be a little bit different. In fact, it's not all that different from the conversation we were just having in respect of enforcement. One has to look at the specifics of the situation in the school, determine whether there's risk or risk of transmission that has been identified, and make appropriate decisions premised on what you find through that investigation.
Okay, thanks, Shalima. Next up, we have Scott from CTV. Go ahead, Scott.
Thanks, Lauren. For both Dr. Davila and the Mayor, you mentioned that you've been in discussions with the province about the reopening plan. So I'm wondering if you can give a sense of what specifically you both want to see in this framework, or what in particular you have both been advocating for.
Well, I have been advocating, and really I have to rely on, in the end, the expert advice of Dr. Davila, but I've been advocating for ways in which we can have things open, but safely. And so that implies, quite obviously, that there would be different circumstances in which gyms and restaurants would be open compared to what was the case before they were closed. I think, these are, I can just tell you that trying to figure out the right thing to do here in terms of the restrictions and in terms of the opening and closing is something that causes you heartache, it causes you brain cramps. It is very hard to search for the right thing to do when there are so many unknowns still out there with respect to this virus. And so you simply do your best to try to achieve a balance that obviously has to put the health and safety of Torontonians first, but also at the same time can maintain a sense of hope and confidence, because those are important to having people comply, with the things that you put in place. And so you look at things that could be done to say, yes, we'll be open, but we're going to be open in as safe a way as possible. And so none of it is going to be a complete revelation. It may be alterations that the province ultimately brings about to things that were in place before: capacity restrictions, table distancing, hours of operation. I mean, these are the obvious things. There aren't too many new things that you could bring forward when it comes to, say, restaurants. And with gyms, I mean, we'd previously stated that we thought group activities represented, this is based on the advice of the doctor, more of a risk to people than other kinds of activities there. So there's a whole lot of discussion going on about a whole lot of those different kinds of things, but I think what people need to know is that they're going to have a degree of stability once the new regime, the post kind of 28-day routine is put in place, that is going to be stable and predictable and understandable, so they can comply with it, so that we can stop the spread of the virus.
So the only things I would add to that are about that balance. And I would say that the mayor is quite right. These are very challenging conversations and very difficult decisions that need to be made. But all the way throughout this COVID-19 response, we have always remained focused on the objectives of mitigating the negative impacts of COVID-19 on the health of our population, on trying to preserve as much as possible the capacity of our healthcare system to respond to COVID-19 and to all the other medical needs that present. And of course, ensuring that we're doing the best we can to manage all the other broader health impacts, the social impacts, and the economic impacts of COVID-19. And so trying to strike the balance between achieving all those objectives has been our primary goal throughout the response. And in so doing, what we try to do as public health practitioners is to bring the best available science and evidence, whether we're talking about our local experiences, the experiences of other jurisdictions, or that which is published in the literature. We try to bring that all to bear so that we're able to provide good advice around how best to achieve the balance between those three objectives.
Follow-up, Scott?
Yeah, thanks. Dr. Davila, you've mentioned looking at other places. You've also spoken many times about how Toronto is kind of unique in this province. But I'm wondering if you've looked at reopening measures in other parts of the world, in other large cities. I think in Scotland, they allow restaurants to be open for indoor dining from 6 a.m. to 6 p.m. with no alcohol, very specific things. But is there anything out there that you've seen that you think would work here? Or is there anything that you're pushing specifically to try here?
Scott, I think there are many things that we're looking at, and whether we're talking about restaurants or gyms or any other businesses that are out there, we're looking at it all, and these are all being considered very, very carefully in our context, right? We appreciate and can absolutely learn from what's been tried in Scotland, what's been tried throughout the world. We do have to think about, are there modifications that are needed for our unique environment, for our people, for our population, for our setting? That's exactly the substance of the conversation, and those conversations are still happening. So, but we do know that the science tells us that, look, there is risk associated with certain environments, right? Particularly those places that are closed settings where there's close contact between people and crowds. So these are the kinds of things that we need to mitigate against, and the challenge that's before all of us is how do we manage the risks as best as possible? And we do so by informing ourselves as best as we can with the experiences from other places. So do stay tuned. We're constantly having those deliberations and discussions on a go-forward basis, because the learning continues every single day.
Thank you. Next up, we have David Ryder from The Star. Go ahead.
Hi there, Dr. Davila. I'm hoping you can drill down a little bit on your statement that our case counts have plateaued. I just want to make sure we know exactly which indicators you're looking at, if you know what has caused the change, if it's because of the modified lockdown or other factors. Can you just maybe give as much detail on that situation as you can?
Well, when you look at our case counts, our new day-over-day case counts, over the last several days now, we are plateauing at about, roughly above 300 new cases per day. And so we've seen that consistently, again, for at least about a week now. And as well, we know that our reproductive number is sitting at about 1. So it's not surprising that these are consistent facts with each other. So the question is, how best do we bring public health measures to bear, both at our level, at public health, and as individuals, to try to bring the infection rate down? We know what the circumstances are that give rise to transmission, and we know what actions make that difference. Keeping that distance, right? Watching our distance from each other, trying to keep our contacts as much as possible only to those with whom we live. Wearing a mask as much as possible. These are all the kinds of actions that each and every one of us can take on a daily basis to reduce the risk and to keep us at our infection rates as low as possible.
Thank you. And I guess the follow-up relates to a previous question, which is, given where we are now, how likely is it that we will move to a case where restaurants and bars and gyms can reopen? I heard lots of words, but I wasn't sure I heard you say if you even think that's a possibility given where we are now.
So David, at this stage, that is something that is under active discussion, and we have been spending a great deal of time reviewing our circumstances here in Toronto, having conversations with those, our public health colleagues around the Greater Toronto and Hamilton area, and as well provincial public health officials. So there isn't a specific answer there yet, but there are many, many conversations and discussions happening, trying to look at all the circumstances, recognizing what our objectives are, right? Reduce the spread of COVID-19, limit that negative impact, protect our healthcare system, and also mitigate all the broader health, social, and economic impacts associated with COVID-19 as well. How do we find the best balance between those different objectives, using the best available science, using our own experiences, and using what we've learned from other jurisdictions to get that balance between those objectives? That's what we're trying to do.
Okay, thanks, David. Next up, we have Jaron from Globe and Mail. Go ahead, Jaron.
Hi, thank you. This is for Dr. Davila and Mayor Tory. First question is, obviously you don't have sort of a set plan for how things will reopen when the rollback, 28-day rollback does end. But in terms of what the business community is saying, what have you heard from businesses about reopening? A lot of them are under a lot of pressure. Have you heard of any sort of creative solutions to sort of get them open when this rollback does end, or do you think that they'll have to hold on longer? And if so, do you have any sort of measures to sort of keep them afloat?
The question about when and how this happens is the question that's causing the heartache and the brain cramps and all the discussion back and forth, not just between public health officials, but also between elected officials, elected representatives. And that is the subject of ongoing discussions. In terms of the business community, I mean, if I've heard a message loud and clear from them, and I've been talking to a lot of them, it's we need to be open as soon as possible because they have grave problems. They've indicated they need to know the details, and I'm going to be talking to the Deputy Prime Minister later today. They need to know the details of the federal relief program. I understand the provincial relief program details are on the way very, very soon, so they need to know that. And I think they need to know something else, which is really why I've been, sort of pushing hard for scenarios that involve doors open safely, which is they need stability. They need to know that whatever the set of rules and criteria that are put in place are there with a view to trying to create a stable environment in which perhaps with a diminished business they can nonetheless do business and do it safely, because they all want to do it safely too. There's not one who sort of says let's just throw open the doors and hope for the best. So that's what we're working towards, all of us together, very hard, but it does involve a lot of a search for the right answer because there are still a lot of unknowns, and it's a very difficult and complex series of questions to answer.
Follow-up?
And just as a follow-up, would you at all consider, this is mostly for Dr. Davila, would you consider more localized measures that would maybe put further restrictions on neighborhoods and areas that are more affected by the virus? So areas that are less affected can maybe be a bit more open than others, or would you continue to focus on citywide measures?
So, I think that throughout the response, throughout the COVID-19 response, we've had to adapt and adjust premised on the information that we have in front of us. At this point in time, we have preferred and have taken thus far citywide approaches. But I think with anything, one doesn't want to necessarily commit to one particular direction or another, particularly when we don't know what the future holds for us. I think we have to do the best we can with the information we have in front of us, the circumstance that faces us, and the best available science. So the science continues to evolve. This is a new virus that's only been around since January, to our knowledge, first identified in January. So there is still ongoing learning in respect of the virus and how best we can manage it, both as a community and as public health professionals in particular. So I think what the people of Toronto can expect from us at Toronto Public Health is that we are going to continue to study our situation, to monitor our circumstances, and to make use of the best available science and evidence and the experiences from other jurisdictions to do the best we can to achieve the objectives of the response, which of course are to, limit and mitigate 19.
Thank you. Next up, we have Mark from City TV. Go ahead, Mark.
Thank you. A question for Dr. Davila. Wondering if you can tell us, of the 4 community vaccine clinics that are open for the flu shot this year, have there been any issues in getting the vaccine and having enough to distribute?
So, as you know, Mark, the flu vaccine, its distribution and its procurement is actually the purview of our provincial counterparts. That is a provincial public health program, the Universal Influenza Immunization Program. And at Toronto Public Health, you're quite right, we are running flu clinics at 4 different locations in the community. To my knowledge, we are so far so good with our vaccine supply, and I do keep in touch with the team on a regular basis to find out how things are going, and we're pleased to see that there's interest in the community in taking up flu vaccine, especially this year, given how important it is this year. So I trust that so far so good, but when it comes to supply issues, we are relying on our provincial counterparts to ensure that that supply is available for us and for all the other providers of flu vaccine in the community.
Perhaps a little bit of clarification. I'm assuming that these clinics are by appointment. I think you've said that before. Should there be any sort of problem in terms of getting these vaccines, and I know that's a provincial issue and what they're dealing with right now, how would you go about notifying those people who have appointments if they aren't able to come in?
So, Mark, I'll have to go back to my team to, hear about how they might manage that specifically in the context of our clinics. And you're quite right, our clinics are booked appointments right now because it is part and parcel of the infection prevention and control measures that are required at this time, given COVID-19 in our community. So we certainly do strive to provide a safe environment for our clients, and we want to make sure that we are contributing as best we can, recognizing that there are many, many other providers who in fact are far more significant when it comes to flu vaccine administration. So family physician offices and pharmacies in particular are the ones who do the bulk of flu immunization here in the City of Toronto. We do run our community clinics. We're pleased to be a part of that, over and above that which we do within shelters and drop-in centers to make sure that those who traditionally have difficulty accessing vaccine actually do get access to flu vaccine, especially this year.
Okay, and last question is Jason from Global Radio 640. Go ahead, Jason.
Hi, guys. Thanks so much for accommodating. I wanted to ask very quickly, it was the active TO comment that was made earlier in the news conference that just tweaked my mind, and I went on the website to look at what will happen with outdoor ice space in the city this winter. I know we're a month away from those rinks typically opening, but when I think about Nathan Phillips Square and the amount of people that go there, thoughts around use of outdoor ice space in the city this winter? What's the thinking around it, guys?
We will come forward at the appropriate time with not only a list of hopefully new and enhanced winter activities outside so that there will be opportunities similar to active TO done in the winter context, but also with the kind of guidance that will be offered with respect to ice rinks. For example, you saw we had to put in place some regimes that I think worked out quite well, and people were very cooperative with regard to swimming pools as to how many people could be there, how long you could stay. You had to sign in and sign out in order to, record contact information in case we had to follow up. And so I expect there will be details that will accompany the use of our facilities in the winter that will be similar, meaning that there will be some different rules that will apply, and we'll come forward with that as a consolidated package before too long.
Follow-up, Jason?
Yeah, I would just ask Dr. Davila how worried she would be about, at Nathan Phillips, maybe you have a controlled situation, but there are 100 outdoor rinks in the city. You're not going to have that everywhere. So what does that look like when you have a lot of people looking to just get outdoors and do something during this winter?
Well, I think that you've just heard the mayor make reference to the kinds of plans that were put into place over the course of the summer. And I think that my colleagues in Parks, Forestry, and Recreation here in the city did an excellent job at managing that. And I have no doubt that they will work with us to make sure that the conditions are right and that we do the best we can to provide a safe and healthy environment in every respect. Certainly we know that risk outdoors is reduced, but there are still some good measures that can be put into place, and I have no doubt that we will have continued good collaboration with our colleagues responsible for setting up those facilities for the winter.
That's it for today. Thanks, everyone. Have a great day.